And this is how you heal hip pain. We're going to be focusing on three muscles: the glutes, the piriformis, and the psoas major. So once again, we're going to take our foam roller, and what we're going to do is try to target the piriformis muscle. Now, the piriformis muscle is a much smaller area that stabilizes the femur in relationship to the pelvis. And now piriformis, or the piriformis muscle, is known to cause piriformis issue, which is when the piriformis is so tight that it pushes into that sciatic nerve, which can cause numbness or pain throughout the entire leg. So what we're going to do first is to inhibit that particular piriformis muscle. In order to find that, what you're going to do is imagine that you have a back pocket, and I want you to put that foam roller right at the beginning, at the opening of that back pocket. That's where the piriformis is going to be. Once you find a little bit of tension there, I want you to put the leg on the side that you're working on and cross it over the other leg. Now, if you can't do that, try to get it as close as possible as you can. Feel free to use your other hand to lift it up. What we're trying to do is get a nice stretch on that piriformis muscle. So all we're going to do is rock our body from side to side, find the area of the piriformis that is most tight or most tense while you're sitting on it. Once you find that spot, all you're going to do is meditate on it for about 60 to 90 seconds while breathing deep. If you have trouble holding yourself up, feel free to take a break and come back to it. Once the tightness subsides after about 60 to 90 seconds, we're going to do some movement on that muscle. So we're going to scrape our butt from side to side on that muscle. You'll notice that, once again, it's not going to feel very nice. So after doing it about 3 or 4 times, we're going to go ahead and manipulate the hip joint. So we're going to do that by pulling the knee towards our nose as close as we can get it, and then driving it as close to the floor as we can. So you'll notice once you do this, you're going to feel a little bit more tightness. Just go ahead and continue to breathe deeply while you perform 4 to 5 repetitions. Perfect. Obviously, you're going to repeat this on the other side. And now moving to the strengthening section. What typically causes hip pain or tightness, once again, is when other muscles around the area try to take responsibility of the bigger muscles such as the glutes and the psoas major. So what we're going to do are 2 strengthening exercises. The first one being what we already did for our quads, which is activate the glute primarily by doing a glute bridge and focusing on the hamstring assistance by pulling our body towards our feet or our feet towards our body, whatever makes most sense to you. And then by also activating the psoas major. So the psoas major is actually the main hip flexor. So in order to get that going, we're going to sit ourselves up as high as we can. So for me, I can achieve close to 90 degrees. For most people, they're not going to be able to do that. So find a position that you can control comfortably. Once you reach that area, we're going to try to lift the entire leg as high as we can. Just as high as you can possibly take it. Now, one thing you're going to notice for a lot of people, it's very common that you're going to attempt to use the quad muscle to lift that leg. So if you feel quad tightness as soon as that leg goes up, I want you to stop. We're already creating dysfunction within our quads that's going to contribute to knee pain. If that's the case, I want you to bend the knee slightly and focus on flexing the hamstrings a little bit while you're lifting the leg. You'll note that now you're going to feel that a lot closer to that hip area. And now the psoas major is an interesting muscle because it connects to the inside of the femur, it travels all the way through the pelvis and connects to your lower back. So it's hard to really visualize that psoas muscle working how it should be. But we're just going to focus on lifting that leg up as high as we can without feeling tightness or soreness of the quadricep muscles. Now I recommend doing a few reps of this as high as you can, maybe about 10 reps on each side for a total of 3 sets each. Once you're done with that, we're gonna go back to that glute bridge exercise. And you're gonna find that having strengthened that psoas major now is actually going to make this glute bridge feel a lot more stable and a lot more strong. And because of that, you'll find that if you do happen to suffer from piriformis syndrome or sciatic nerve pain, once you stand up, you're gonna find that doing those exercises and that self-myofascial release brought that pain and tightness down a little bit. And there you have it. That is how you fix your hip tightness and pain.